So you've chosen to focus your project on the obesity project. Right here to introduce the topic, I have my very own son, Jordan.
Obesity is a tremendous public health problem with over 17% of children being obese.
Obese.
obese. Many are not physically active like me.
Excellent. So for this project, after a lot of discussion, we decided to hone down on the specific issue area of physical activity. Obesity itself has so many contributors, and in order to build an effective project, we decided we wanted to have a very specific focus with measurable outcomes and very specific deliverables. And as we discussed in the curricular aspect of this, all our projects have very significant activities on both the clinical, community, and policy levels. So you are going to choose a specific item in the overall project work plan to focus your project on. But as you know, this will be part of an ongoing sustained effort. What you can do is you can look in the Google Doc site, which you will get log-on information to, and pull up the document labeled Obesity Project Work Plan 2924. Basically, a review of the national and state guidelines on physical fitness revealed that there is extensive discussion surrounding the importance of physical fitness. However, a concrete description of how to actually achieve physical fitness is lacking. Through this project, we will work on assessing the amount of physical activity children currently receive, as well as resources available in the school and other settings. We will further work to promote physical fitness by improving awareness and access to resources. Just so you know, it took us a while to actually establish this work plan. A lot of work went into surveying patients and families and doing a needs assessment amongst physicians, pediatricians, and others to see what was most needed. There was a great consensus that there was a lack of information in the hands of pediatricians about opportunities in the community for physical fitness activities, about really effective ways to motivate and promote physical fitness within their patients and families. And there was also a really big acknowledgement that schools were not likely meeting the guidelines that were recommended in terms of physical fitness, whereas many parents weren't necessarily promoting physical fitness at home because they felt that gym class alone sort of achieved the necessary physical fitness needs of their children. So, on the clinical level, we aimed the focus of this project to be, as pediatricians, we have both access to and attention of children and parents. We will work to educate ourselves as clinicians on specific recommendations we can make to our patients regarding physical activity. The clinical venue should be used to relay recommendations and resources directly to our patients and their families, as well as to set achievable goals. So you're entering this project at a very exciting time on the clinical level because we've actually done quite a tremendous amount of work. A wonderful brochure was created for parents and families that you can find in the folder labeled Obesity Prevention. And specifically, it is labeled Patient Brochure. It's got a lot of information and it's in a very user-friendly, well presented way that is ultimately going to be disseminated to children and families. Another folder in that Google Doc site is age appropriate recs for PAs and physicians. And so that is actually education for pediatricians to share with their patients and families about other specific things that parents can do at home, what the recommendations are, how often, how many times a week, what are good suggestions that should be used to educate physicians and pediatricians. The other relevant document to the clinical level of this work is labeled Dissemination Plan 1. And this has to do with this acknowledgement that there can be a million pretty, wonderful brochures. We are inundated with information all the time that is really important to share with patients and families. So how do we weave this into the current clinical system so that the information gets shared repeatedly, recurrently, even when, for example, you yourself may not be the one in clinic? So this has a lot to do with systems changing. You may need to work with a specific administrative staff at your clinic and very concretely to make sure that there is a system in place to have the brochure replicated. we want to do very specific targeted education and outreach with both physicians and nurses alike who have opportunities to provide anticipatory guidance to children and families to ensure that part of their routine questioning of children focus on physical fitness. One resident is even exploring interweaving a reminder about this and a checkbox about this into the electronic medical record. And so if you're focusing on if you've chosen the obesity project, there are several residents who are really working on their dissemination plan. This is an area where we need less input at the moment because we have a very solid work plan in place. If this is an area that is of particular passion to you, then you can choose to focus on it. But we think that we have the beginnings of this covered quite well, and that there's actually more opportunity for needed contribution at some of the other levels. So you can think about it after you hear all the levels. And again, if this is an area of very specific passion for you, then we can talk about what you can specifically contribute to the clinical aspect of this. Regarding the community aspect of this, we decided again to have a very specific focus, and that was working with local schools in order to partner to promote physical activity within the schools, because we found out through a very extensive survey developed and administered by some of our very dedicated residents that in fact, as we had hypothesized, that our local community schools were not meeting the federal and state guidelines around physical activity recommendations. And so with that, if you look in our Google Doc site, you can see a whole area under the obesity prevention labeled survey. It's a separate folder. And in it are the results. So you can open the document that says results. And particularly, you might want to open the document that says summary of survey results, which reveals the feedback that we got from many schools. At what age, including at what age do children first receive physical activity? How many times per week the physical activity occurs for each student? And we found out that the results were extremely variable, ranging from only half of classes in an elementary grade received physical education even weekly, to once weekly, to 2 times to 3 times weekly. Um, a lot of them had complaints about their actual gym space. In some cases, it was non-existent. They had to use the cafeteria. They had a big limit of space. Did they educate parents about the value of physical activity? Did they interweave opportunities for physical activity as well as emphasizing the value of it into the curriculum? Overwhelmingly, the answer to that was no. We saw a tremendous opportunity in that. We also explored how they use their space during off-school hours. This is a safe space. In some of the communities that your patients come from, there is a concern about the safety of some other public spaces, and that the school space would be an ideal safe space that is sort of underutilized in terms of opportunities. And so how can we partner with schools? When we did reach out to schools with the survey, many of them were really happy about it and shared very specific comments that, wow, we're really excited. We'd love to partner with you. What are our next steps? And so another one of our now third-year residents began to create a tool that we can use to reach out more formally to schools to engage them and begin to implement partnerships. This is a two-pager that you can find also in the Google Docs site. And it basically summarizes the statistic, the survey of the results, and it not only does the survey, it not only summarizes the results, but it makes the case. It sort of begs the question as to why physical activity is so important and why the schools represent a really ideal venue through which to promote it. And then it suggests opportunities that we may be able to partner with schools. Some very, very simple and implementable ones might include us sharing, for example, the brochure that we want to disseminate in clinic with schools, having them certainly send that home. Us doing very specific education to both parents, for example, via the PTA, as well as teachers, as well as thinking about other ways to interweave physical activity into the curriculum itself. There are other best practices in other states and other models that really have a more integrated partnership between health professionals and schools in order to implement school changes in the schools. And part of the goal for this toolkit or two-pager is to begin that dialogue with our local schools and explore what's feasible, what's fundable, what can we do, what can we help advocate for. Of course, this is around the physical activity. There are a lot of existing initiatives and opportunities around working with schools to change the nutrition, for example, of what's offered in the cafeterias. People have proposed having people help children during the lunch line to make healthier choices, talking about what's available, interweaving issues of that into the curriculum, looking at, the sugar-laden juices that are served. But again, this current project where we're at is quite focused on the physical activity aspect. And so the next resident that's up, there is a list of all the schools that we reached out to. Um, and you will find that again under the obesity project. I'm just actually opening that um, right now. And there is a document called School List and School Outreach Data. So the school list actually has the names of the schools, the contact, the email contact, and the phone contact of the person that we reached out to, and the result of if they responded, etc. And so this is a great place to start. The next step with this is that we want to expand upon the tool and make a plan to have folks together at the school. Who would be the natural people to be, for example, at initial meeting? We learned that it's not always so obvious. So in order for us to have gotten to the physical education staff, we had to actually get approval from the principal, and there are lots of different people involved. And I think at any initial meeting, it would be really important to have the gym teacher or the physical fitness director, as well as is there a health curriculum, the person from the health curriculum. It's always really important to engage the PTA because that's, again, an opportunity of support. Are there other administrators that need to be present? So whether that's a principal or an assistant principal, this is a potential, really important opportunity and partnership. And so the most support that you can get and that you can leverage will make your projects go a little bit further. And that's actually an advocacy or a community pediatric skill. It's sort of bringing people together and having more power and more capacity because you're able to build champions within that school and build important relationships. And so again, we would like, as a next step in this project, to reach out to schools for the next resident who would like to take this on to prepare for and schedule at least one, but hopefully two meetings and evaluate what comes out of that meetings. Do we want to focus on a partnership with one school? Are there certain issues that come out that can easily be disseminated and scaled and shared with other schools? And again, this is a key part of the vision of this project. Another sort of another parallel track at the community level is that we did begin to reach out to WIC sites, which we know have been very traditionally focused on the actual nutrition of young infants and children, to explore opportunities for them to expand their focus to do a little bit more anticipatory guidance around physical activity. And so some relationships were established at some local WIC sites, actually the one that you do your site visit at, but there is an opportunity for someone who's interested to sort of scale that up to look more at the broader network of WIC sites and how to better integrate opportunities to promote physical fitness within the dialogues that they have with patients and families, and much like the clinical level of advocacy, how they might integrate having information about physical activity and physical fitness within their sites in terms of educational materials, in terms of anticipatory guidance, and other pieces. The next level that we said that each project would have some activity on is the policy level. And so what we did was a resident last year put together a really wonderful document that described what are the not just recommendations but actually sort of mandates or regulations that both the federal and the state government puts out around physical activity in the schools. And so this is labeled the one pager on obesity in the Google Docs site. and it talks about the National Association for Sport and Physical